Welcome today to everyone to today's webinar, Novel Coronavirus Crisis Management and Planning. My name is Sal Gilberto. I work in marketing here at Everbridge. You'll soon be hearing from Regina Phelps, an internationally known speaker, expert on crisis management and emergency planning. I'm going to start today's webinar. We're just going to dive right in because we have a lot to cover. We'll go over some housekeeping items. We'll meet our speaker and then we'll get right into Regina Phelps' presentation. We're going to try to leave a little bit of time for Q&A at the end, but as I mentioned, we do have a lot to cover. So with housekeeping, we are recording today's session. We will make that recording as well as a copy of the slides available to you. We will be emailing that out tomorrow, perhaps the next day, depending on how fast we can process the recording of the video. So if you do want to share this presentation or review it again, you will have the opportunity to do so. Again, we're going to try to allow for some questions at the end. We have a big audience and a lot to cover, so I don't know if we're going to be able to get to too many questions. But if we do, we're going to address those questions at the end. You could submit your questions throughout using the GoToWebinar control panel. But again, we will be answering questions as best we can at the end. I just also wanted to mention that we do have some additional resources that we will be pointing your way after this webinar. So Everbridge does produce a coronavirus situation report. We update this frequently. We will provide a link to give you the most up-to-date situation report. You can check back and get it as it's updated. We also have another webinar coming up on February 28th. We'll provide the link for that. That's Coronavirus, Government Policy and Operational Response, presented by Richard Serino, former Deputy Director or Deputy Administrator of FEMA. And we also have a document that you may be interested in, which is our Coronavirus Preparedness Kit. So with that, I would like to introduce our speaker, Regina Phelps. How are you doing today, Regina?
I'm doing great. Thanks for inviting me today.
Well, thanks for presenting for our audience, eager to know what's going on. So I'm going to make you the presenter. And if you want to show your screens, I'll let you know when you're showing.
I should be up.
Perfect.
Great. Thanks, Sal. Thanks for that kind introduction, and thanks to all of you for joining us today to learn more about the status of the new novel coronavirus. And what I will spend most of my time today talking about crisis management and infectious disease planning and what you should be doing right now in your organization. And let's take a moment just to look at my agenda before I dive right in. I want to talk about the current threat, and of course, this is changing hourly in some cases, and so I'll give you the current status. I really want to focus on the 10 things you need to do right now, and those are really under the broad umbrella of crisis management, business continuity, and infectious disease planning. I want to talk about personal preparedness, and then I'd like to share with you some next steps. So let's talk about where we are right now as far as the coronavirus is concerned. Now, I'm sure all of you right now are experts in what the coronavirus is, but just in case you haven't been paying complete attention, the coronavirus is a very common virus. It's known to be found in the upper respiratory and gastrointestinal systems of mammals and birds, and they are the #1 cause of common colds in humans. And there are 7 different kinds of coronaviruses. When you look at the slide, the first 4 are the ones that we have had probably many times, creating the actual common cold. The 3 that are probably most famous, most infamous, are SARS, MERS, and the now newly named, by the way, COVID-19. That's the new novel coronavirus that was just named by the WHO today. So we have a new name. Not very catchy, but we'll all remember it. When you actually look at this particular virus and comparing it to SARS and MERS, there's some interesting numbers to take a look at. So first of all, going to the bottom of the stack here, MERS, which is the shortest number of cases, the least number of cases, only 2,500, a little less than 2,500 cases, but a whopping 858 deaths, so a fatality rate of around 34%. SARS, which had a little over 8,000 cases, 774 deaths, had a fatality rate of about 9 to 10%. And of course, our new COVID virus has 43,000 as of about an hour ago, and a little over 1,000 deaths, and the fatality rate's 2.4%. So much lower fatality rate. It's higher, of course, than the annual influenza. The annual influenza deaths run around 0.1 to 0.5%. The 1918 influenza pandemic was about 2%, to give you a sense of the stats. The current threat, of course, did erupt in China in December of 2019. December 1st was the actual known first case, and most of the cases initially were all linked to the visitors and workers of a seafood market in Hunan. January 2nd is when the actual strain of coronavirus was actually discovered and designated, so that's when it was actually mapped. It's now named the new COVID, as I mentioned, as of today. 2/3 of the initial people all had direct exposure to the market, but of course that has completely changed. The definitive origin of the illness, the source, has not been determined, and there's now a conversation between whether it's a pangolin or a bat, either one of those, and both of those animals could be found in that market. So the current stats, again, as of today, as I mentioned, a little over 43,000 cases, a little over 1,000 deaths. There's 27 countries, 12 cases in the US, 6 in California. There are other locations. Cruise ships actually are designated in the count as other locations, since technically they don't belong to any nation. The incubation period is 2 to 14 days. The average is around 5.2 days. And the first case of human-to-human transmission in the US was actually on January 28th. If you aren't following this site, I would highly recommend it to you. This is a screenshot I pulled about an hour ago. This is off of the Johns Hopkins site, infectious disease site. They have a really nice calculating device with all the current countries, the cases, total recovered cases. And as you can see, when you look into the left-hand side, after the number for mainland China, you'll see there's 135 others. Those are ships, which are kind of like floating nations, I guess, at this point. And then the rest of the countries are listed below, with Hong Kong, Singapore, and Thailand being the top nations outside of mainland China. And by the way, the case count right now, 99% of all the cases are in China. And the other thing I'd like to point out about this slide is if you look to the lower right-hand side, you'll see there's been a real change in the orange diagonal line. For quite a while, it was actually shooting up almost straight as a diagonal. And it's really begun to shift over the last 4 or 5 days. So the cases are beginning to, looks like, level out, but we'll find out more over time. What I'd like to do is talk about the 10 things you need to be doing right now. And I really hope that many of you are well engaged in your planning. And what I'm really doing for you is offering you a kind of a quick checklist for you to be thinking about. You've covered everything. If you haven't started, I want to inspire you to actually do that. The first thing I want to talk about is for you to update and work on your infectious disease plan. And that takes us back to the 2009 pandemic. So in my company, we've been doing pandemic plans and infectious disease plans since about 1998. So a very long time. We have written hundreds and hundreds and hundreds of plans. And prior to the 2009 pandemic, all of the plans were tied to the WHO pandemic levels. And so literally, if you were to pull up a plan, you'd see when the WHO got to level 2 or 3 or 4, you would do the following things. Well, the 2009 pandemic, which maybe many of you only vaguely remember, was very mild. Yes, it would made a lot of people sick, and it was a huge health issue across the world, but it was not a catastrophic infectious disease that we were thinking of a la 1918 Spanish flu. So because of that, it wasn't very deadly. And therefore, when you looked at the plans that we wrote, frankly, we were so disappointed because you had to really tweak them to make them work. So since that time, what we have done in our firm is we've completely changed our planning process, and we're calling this Infectious Disease Plans 2.0. And I would really encourage all of you to think about taking out your pandemic plan and doing the same thing to it. As I mentioned, there were a lot of flaws if it's tied to the WHO levels. And the reason for that is that all diseases are local. And so I'm highly recommending that you write a disease plan now called infectious disease and pandemic plans, because in reality, you're a lot more likely to have a disease like measles in your call center, frankly, in this day and age, than you are an occasional global health crisis. Because of the lower vaccination rates in the US, it is very common for us to have an outbreak of whooping cough, measles, mumps, chickenpox that we never used to see. And so I will tell you that's why you should be thinking about modifying this, because you could have the disease and everybody else around you could be perfectly fine. When you write a plan, it should be written with very broad guidance, and it should be able to broadly accommodate all illnesses. And the reason that's important is because diseases change and they shift. You might think it's going to be bad and it isn't. You don't want to write a plan that's going to pinhole you into a certain type of behavior. It should be flexible enough to work with anything. The other reason you want to be flexible is that medical treatments and preventative measures will change over time, and you don't want to make your plan dated. And the last and really important thing for you to understand is that you do not control your destiny in a public health emergency. Who actually dictates what happens to you is your local Department of Public Health. Or if you're outside the US, it could be your national health department. They tell you whether you're open or closed or what you have to do. So you have to have broad guidance, but I will tell you who's going to drive the boat for you, if you will, is going to be the local Department of Public Health. They have the power to evoke what's known as public health law for all the obvious reasons to make all of us healthy and safe, and they will control what happens to you, and they will issue instructions and orders and dictates based on the illness. In the last several years, we've had several of our clients have to close buildings, call centers, data centers because of measles outbreaks. So it does happen. And that's because diseases are local. And that's what we really clearly got in our minds after the 2009 pandemic. So that's what you have to be thinking about. Currently, right now, we are experiencing a global health issue. And unless you actually are in China, you are actually seeing probably no local health impacts, with the exception of Singapore, which is having quite a nice outbreak right now. However, does that mean that you should do nothing? And the answer, of course, is no. I really believe that you have to do all the things I'm mentioning to you today, which are 10, but minimally things like health education for your employees, making sure you have hand sanitizers, and just being smart. You do not want to be flat-footed. Some of my clients, and maybe some of you already, are starting to have major impacts in supply chains. Have you tried to buy gloves? Have you tried to buy masks? Many of my clients are significantly impacted now because they buy products out of China, and manufacturing facilities have been closed for over 3 weeks, and the ones around Hunan have been closed for over a month now. So supply chain interruption is what we're certainly going to see, and I'll talk more about that. When we write an infectious disease and pandemic plan, what we are going to write it around are 4 planning assumptions. I would encourage you to think about the same things. First of all, the planning assumption, the first one we have is that you would manage this using your routine crisis management team processes. So I hope all of you have a crisis management team process and structure. I hope it has a strategic and a tactical level. And my hope is that that's what you would be using to manage this particular event. The second is that you're going to receive advice and counsel from your local departments of public health and other medical professionals. Many of my clients now have been asking infectious disease physicians to consult with them because they've had some interesting and problematic cases. And so it's important that you have not just the Department of Public Health that you can rely on, but an infectious disease physician is a really smart investment in your planning process. The other assumption that we make is that your usual emergency response procedures and emergency response teams would function as long as they normally can. Many companies have floor wardens or emergency response team individuals who might be first aid trained, who might go to help somebody who has a medical emergency. And we would assume that those things would continue as long as it was safe to do so. And lastly, we assume that you're going to remain open as long as it's safe for you to do so. And again, when it's not, you're very likely would be closed by the Department of Public Health. There's a couple of scenarios that we think about when we think about an infectious disease. So it is possible, as I mentioned earlier, to have a localized disease that only impacts you. It does not rise to the level of pandemic. It's not going to be severe or catastrophic to anybody but you. So that goes back to a contagious issue of measles or norovirus. So the plan you write should work just as well for that as it would be for a global pandemic of a serious nature. So you want to think about a localized aspect of the disease, but you also want to think about something that's global. And when you write an infectious disease plan, it's not really a fine science as much as it is good judgment and good consultation with the local departments of public health when that situation occurs. So you need to be flexible in how you create it up. When we write a plan, basically they have 3 stages. The first stage is the pre-outbreak preparation and planning stage. That means there's no current risk wherever you are. And so right now, if you were to have one of our plans in your hot hands, you would have done everything on that list. And that's really divided between 12 departments. When an outbreak or area issues occur in your region, or as it initially first occurred in China, all of our clients did a threat assessment to determine whether they actually had any kind of exposure to this issue. Most of them have had no exposure personally, but many of them have activated because of supply chain disruptions. So your threat assessment will tell you whether you need to have any activation of your crisis management processes. Once you actually have disease on the ground, so local diseases, then you really dig in and activate your plan. And we activate them based on a severity level and impact. And we color code them into yellow, orange, red, and gray. And so for us, what it looks like is this progression, because again, diseases are about the human connection, right? So in our case, when we have a lower minimal case of transmission, it's yellow all the way, as you can see, through gray, uncontrolled and uncontrollable human transmission. So in your plan, when you look at it, it should be color-coded related or organized related to this local impact. Not what's happening in a different part of the world right now, but local impact to you, because that's how your plan is actually going to roll out. Most commonly when we write plans, they're actually in 12 areas, and you can see I've listed all the departments or functions here. You might have additional ones as well. For example, the business unit ones could be really deep right now in relationship to assessment of supply chains and looking at third-party vendors and so on. But you can see these are very common departments that you would have different types of plans for, but we're really talking about what these 12 departments would do in those 4 areas I mentioned just a moment ago as far as impact in your area. The last thing that we do in all of our pandemic plans is we do what's called employee categorization. And if you don't do this now, I would highly encourage you to do it, because frankly, it's really good for a business continuity process to begin with. And let me explain a little bit about this. So this sort of tells you a lot about resources, what you need in order to be able to conduct work, have people at work safely, but also how they can actually work safely and be able to be productive at home. So we ask our clients to divide their employees into essentially 4 categories. Category 1 are those individuals who perform time-sensitive mission-critical functions, but they have to be on the job. So for some of our clients, that would be things like manufacturing, or things such as possibly a security officers, or maybe you have to have people within a data center, or maybe you run a laboratory. The idea is that you have to have people on the job in order to do those functions. So we asked you that you categorize them, and you actually then know how many are going to go to any particular building. Why is that important? Well, it tells you right away which buildings of yours have to remain open. It tells you which floors might have to remain open. It would tell you what kind of security presence you might need to have, how much cleaning you need to have. It would also tell you about the kinds of personal protective equipment you might want to have in your location, because you have an exact number. And you don't have to think about it. You don't have to ask people. You just pull it up and you know. Category 2 are those people that perform mission-critical, time-sensitive business functions, but they can work remotely. So that puts you into a whole nother category of things. Do people have the right kind of equipment to work remotely? Do they have the right laptops? Do they have the right high connectivity that you need for them to be productive? Do you have the VPN capacity to be able to take in all of those people that are working remotely? And do you have the ability to kick off those people that should not be there? Super, super important that you understand that. Many of my clients have actually done work from home tests, and they do that with a whole department, and they'll send them home for 5 days and say, okay, let's see how you can productively work at home. And what they sometimes find is that some people have a difficulty working from home because they don't either have a piece of equipment that they need, like a scanner, let's say, for example, or there's some other aspect of their job. But you only know that when you actually have people working at home for a sustained period of time in a work group, and you can see what works and doesn't work. You could do that right now. Category 3 are those people that they don't perform a mission critical or time sensitive function, but they could work remotely if feasible, or they could backfill somebody that's a 1. And category 4 are those people that do not perform mission critical or time sensitive functions, and they cannot work remotely. So you think of like a receptionist, let's say, or maybe somebody in shipping or something like that. So when you think of these particular categories, not only should you take this out to your business units now, have them categorize every one of your employees, but the other thing you should do with it is actually drop that into, if you have an HR database, like PeopleSoft or something along those lines, where you could actually put in a new field and you could drop in the categorization of that employee. And then you could immediately do a sort and find out how many category 1s you have at every location, category 2s, and then you could do planning appropriately. The last part of the plan is there's a big appendix at the back of the ones that we write. They include a variety of things that you're going to need. Things like in HR, things about education and monitoring. How do you know people are sick, which is what the monitoring refers to. We really ask all of our HR teams to really come up with what the compensation and benefit policies will be now. And then you always have the opportunity, of course, to change them later on, but it's really hard to start with a white piece of paper. And so we encourage you to think about that now. Things about your incident or crisis management team, think about maintenance and janitorial, respiratory hygiene, that gets into coughing your sleeve and washing your hands and all of that. No handshaking, no meetings face-to-face. What are you doing about visitors and lobby policies? And then what are you doing about travel? I'm assuming that all of you have certainly banned travel to Asia at this point, or at least China and possibly even most parts of Asia as the case count goes up in those other areas. So that would be something that you would want to make sure that you have a policy related to that right now. And if you do have people that come back from those locations, they should be quarantined at home for 14 days. So that's the first piece, a big piece. The second part is super important, and that's about understanding what's going on around you. That's developing a regular SIT-STAT report, that situational status report for your crisis management team and your executive team. As far as what situational awareness really means, it's really the ability to identify, process, and comprehend information that's critical regarding an incident. So essentially, it's answering the question of knowing what's going on around you right now. Now, that may sound easy, but let me tell you, there's a lot going on. And it's not easy to be able to really present a solid picture of all the things that you need to be considering. So I recommend that you do basically two things under this broad umbrella of situational awareness. First of all, you have to collect information, and then you actually have to process it. There's two ways you're going to collect it. First of all, you need to look internally. We've been asking all of our clients, especially in Asia, to be doing this on a daily basis. You need to know essentially what's going on right now in 5 areas. What's going on with your people, what's going on with your facilities, technology, business operations, and anything related to your reputation and brand. These are kind of a sample of questions that we have designed for some of our clients that they've been sending out on a daily basis. So, for example, we're asking them to really tell us what's going on in their region every day. So in some places in Asia, the governments have really gotten aggressive about making sure that temperatures are checked, and this is outside of China. Temperatures are checked on a daily basis when people come to work, that there is social distancing, and so they're requiring those things. So it's good to know and understand what's happening from a perspective of the government regulations. What are people doing on the street? What about public reporting and social media? And you also need to be monitoring your illness. Is it the same as it normally is for this time of the year? Any problems in your facilities? Do you have sufficient supplies? Any other issues related to your facilities? Do you have technology issues? Excuse me. Do you have any problems with bandwidth with people working from home? Do you have issues related to cyber attacks? There's been a huge increase in the number of cyber attacks that have been caused by organizations that are actually doing phishing, as well as other issues that have been a problem. And I'll talk more about that in a bit. And you want to be talking about that with your technology professionals. Under business operations, you want to look at the impact on your production. So is there anything that's going on in your area that is a problem? Are you having a problem with your supply chain? Are you having an issue with your vendors, and what's going on with that? So really looking at your supply chain, are you able to actually produce what you normally produce? Are you having any quality problems, any customer issues? Many of my clients are getting tons of questions because they're a third-party vendor and they want to know if they're going to be able to do whatever they've agreed to do. And then lastly, anything about reputation or brand? Is your organization in the news? Have you had news inquiries? Do you have your holding statements ready? And I'll talk more about those in a bit. And do you have your crisis communication advisors on call and at the ready? And I hope you do. So that's all the internal information that you should be receiving. You also want to then get information related to external credible health sources. The WHO, of course, they have a pretty solid site right now on the novel coronavirus. CDC's got good information, your local health department, and as I mentioned, you might want to be contacting with an infectious disease physician as well. You want some really good external sources for news. Some really stellar reporting has been coming out of the 5 that you see there. The New York Times, Washington Post, Bloomberg has had some great business reporting over the last month in relationship to the virus and the impact to the economy and the forecasted impact to the economy. The Guardian as well out of the UK, and then NPR here in the United States. If you are using social media at all for your situational awareness, you've got to triple, quadruple check whatever you're seeing, because there are some incredibly crazy and screwy ideas that are out there on social media. There's lots of conspiracy theories. This happens to be one of them that I think is pretty funny, but I think a lot of people might believe it. And that is that the CIA has released this virus in the United States so that we would all have to be mass vaccinated. This guy has a huge following, which I think is pretty amazing. So once you have the information, now what you have to do is you have to process it. So what does that mean? You have to organize it into some digestible form. That's called a situation status report. Ideally, what you're doing is you're disseminating this to your crisis management team, which is the tactical team in your company, and your executives, the strategic team. If you're fully activated, you might be developing incident action reports using the SITSTAT document. And I would really encourage that you look at the new format that's been designed by the WHO. I'm going to show it to you. This particular format is great, and we've actually set up a template just like this for many of our clients. It is super. If you stop and look at it, you can see really quickly exactly what's going on. So this was the report 2 days ago. They issue it once a day. You'll see the numbers that are cascading on the right, and then kind of what the big issues are. And in this particular one, they were focused on what's happening on the Diamond Princess, which is the ship that's in Yokohama, Japan. Easy to read, easy to understand. This is like half of the first page. The page below this is a map of the world, and then all the subsequent pages are information. You could do exactly the same thing. Highlights of what's happening in your company or things that might be going on in the world, and then the situation and numbers, and then more key data as you get into the report. So first two things, really important. I cannot emphasize that if you were only going to do two of all the things I'm talking about today, the first two is where I would put a lot of time and energy. Relooking at or writing your infectious disease plan and looking at what you're doing from perspective of situational awareness. Now we get to one that might be challenging for some of you, and that's really assessing the impact of company supply chains. You know, when you stop and think about it and where things come from, you know, there's kind of a one-word answer, and it's China. There's so much that comes from China. And I think we're about ready to see how much as this factory shutdown continues and as supply chains become significantly interrupted. So I would ask if you to work with your key departments in procurement and also do at that point a supply chain assessment. It's not just good enough to find out what vendor you're buying the things from. You need to know ultimately where everything comes from. So it could be a tiny little part that's in a particular machine, like a piece of medical equipment, and many of those tiny little parts are made in China. So you need to really map out your supply chain, and you need to really look at your suppliers, your internal and your external customers. Excuse me, I've got a bad allergy today. You also want to then look at the areas of concern and really work to mitigate any of these strategies. And let me give you an example here. This is just a little snapshot of the kind of manufacturing that's done in Wuhan, China. Take a moment and look at that graph. You're going to see they do a lot of phosphorus mining. That probably doesn't impact most of you. But are you in clothing? Are you in retail? Cloth, yarn? What about glass? Glass goes in many things. Fertilizer, sulfuric acid, cars, beverages, cement. Wuhan province has the economy the size of Sweden. It's pretty amazing. This is 11 million people. It's a province that's home to a wide range of industries, a lot of education. There's a lot of autos, healthcare, aerospace, defense contractors. It's the fourth largest car producer nationwide in China, and they make parts for many, many, many organizations. So I would ask all of you to seriously look at this. Healthcare is really going to hit hard because of not only masks being in a shortage, but think of gloves, think of disposable gowns, many things that are used in a hospital on a daily basis. Almost all of that comes out of China. The fourth thing, and a really important one, is communication with your key stakeholders about what your plans and your status is. So I've asked all of our clients now to make sure that they have holding statements right now. So if you're contacted by a big customer, an investor, a regulator, asking, what is your level of preparedness? What are your areas of concern? You should not have to debate at all about what that is. You should be able to say immediately what that is. You want to be able then to develop initial communications from those holding statements. So those should be developed now for all of your key stakeholders, starting with your employees, your big customers, and go down the list. What are those holding statements? What are the initial communications? And have those at the ready. You should also have another set of communications, which is if you actually get a case of the coronavirus at your business. That's happened to a couple of our clients. And there's that big stumbling moment like, oh my gosh, it's us now. And you don't want to be in that kind of situation. You need to have exactly what you're going to say right now, if indeed that happens. And because there's still very limited cases outside of Asia, out of China in particular, that everybody would be looking at you. And so you need to be solid in your communications. So 2 levels there. If you want to look at somebody who's doing really a great job at crisis communications, I would call your attention to Princess Cruise Line. They have, as you all know, a ship that's in Yokohama called the Diamond Princess, and it actually has been stranded there for about 2 weeks now, with a large number of passengers and crew, and outbreaks of coronavirus still going on. If you go to their website, and this is what their website looks like, you'll see at the very top there's an update, and it says click on this and you'll find out about current travel health advisories. And when you go there, I took this off a couple of days ago. This is their update, which they put up every day. Talks about exactly what's going on in the Diamond Princess. There's also videos that you'll see from the president, EVP of communications and guest support, what they're doing for their guests. It is very transparent and really, really a great, great job. The bad news for them, I don't know if you've heard this, is that people that are quarantined on that ship, every time there's another case, they have to reset the quarantine clock of 14 days. This was actually formally addressed by Japan last Friday, where they said that indeed every time a new case came up. And so it's actually been reset several times since then. There's 3,700 people on board. Pardon me, the quarantine was set to end on February 19th. It's been reset again because there's new cases as of yesterday. So this will keep going on, unfortunately for them, for a period of time. Number 5, educate your employees on smart health habits. Now you may think, well, gosh, is that our job to educate our employees? And I would say, yes, it is. You need to really promote good hand washing, signs in restrooms, signs in break rooms. Many of my clients now have bottles of hand sanitizer that are on every office desk and every conference room table. Before any meeting begins, people pass that around. So talking about good hygiene, talking about good cough hygiene, covering your cough, putting up your arm, putting your face to your sleeve, making sure that you cough into a tissue, but do not cough into your hand. The other thing I would really encourage you to think about is when people are sick, they need to stay home. This is called presentism, when people actually show up to work sick, and therefore we end up infecting many other people. So at this point in particular, I would really encourage you, we're still in the middle of the flu season. Talk about good hand washing, talk about hand hygiene, talk about staying home when sick. Now in my presentation, I'm not going to talk about the treatment today of the coronavirus, because if you have a mild case of coronavirus, you're going to treat it just like you would any other flu or serious or illness like that. But there's lots of things that are on the internet, and I would turn your attention to CDC if you're particularly interested in medical treatments of the disease. Number 6, I would really encourage you to market your company's emergency notification system. This is the best time for you to make sure that you've got the right information in that database. You want to make sure you have people's home phone numbers, their personal mobiles, their home emails. You want to make sure that you have the ability to contact them about if there's a situation that occurs at your office, if all of a sudden you're going to be instructing people to stay at home, if you're going to activate your disease plan and maybe only Category 1 staff come to work. You need to be able to have that kind of tool so that you're not having to dial a zillion phone numbers. So you want to make sure that now there's the opportunity to really market the value of this is a way that I can communicate to you in an emergency. You can also at that time educate them about how they would respond back to you. So if the ENS that you use has the ability to have a response vehicle, you could actually practice that so that people understand that if you were surveying them to see if they were well or ill, how they would press yes or no, and they could do that now. So I would encourage you, once you've really encouraged people to really refresh their information in your employee database, that you actually then conduct an emergency notification exercise so that people know exactly how your system works. Number 7 on my list is I would encourage you to review your BIA and business continuity plans through the lens of an infectious disease. Now you may say, well, Regina, that's kind of crazy. Why would I do that? Because after all, it's meant to be when people aren't able to come to work, or we've written for all kinds of scenarios. And I'd say, well, yeah, okay, great. I know that plans are generally written for a lack of people or facilities or technology or equipment, but I will tell you that most people don't expect that a large number of people are not coming to work, or a large number of people might be working at home for a sustained period of time. So you need to really go back and look at your BIA and your business continuity plan and ask yourself the question, if we were all in a situation where our office was closed for 14 days, how would this be working for us? And maybe the answer is, oh my gosh, some things wouldn't work at all. That's the kind of conversation you need to have right now. Because if you do get a case of the coronavirus in your office, it would be highly likely that the Department of Public Health would shut you down for 14 days. And they would shut you down for as long as cases kept coming up. So if on day 10 of your 14-day quarantine, one of your employees came down with the illness, the clock would start again. So just ask yourself, how long could you tolerate that? And look at your BIAs and BCPs through that kind of lens. So I think you need to really look seriously at staff categorization. I mentioned that earlier, making sure that you've got those 1s and 2s at minimum well identified. Have you thought about doing social distancing, and how would you even do that? Think about a call center. Some of the call centers I've been in, people are so close together, there's no way they could be 3 feet apart. So how would you do that in a call center if you could stay open, but you want to do social distancing and have people 3 feet apart? How would you do that? What about shifting work to other locations? So maybe your headquarters is shut down, but you have another location that's available. Can they really just move work over there? How would that work? Have you ever done that? Maybe you should think about documenting that, doing an exercise, seeing if it works. Cross-training and having other people being able to do other jobs, because again, we are short of staff. And then I will tell you, you might need to really reevaluate what is really, 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 really critical. I know that you say, oh gosh, but we've done our BIA and we're absolutely positively sure. Well, you know, if you were closed for 14 days or 20 days and you had a lot of people that couldn't work, you might reshift that list again. So I'm really asking you to really take a look at it through that kind of lens. Number 8, this is a really interesting one. I really think you need to check in with all of your critical third-party vendors and ask them, what's going on with you? You know, for example, you might have call centers in the Philippines, or you might have call centers or other third-party vendors maybe that do technology support in different countries. They might be in different parts of the US. Well, how are they doing? Are you heavily dependent on them? What about your cloud computing services? You know, the cloud isn't the cloud, it lives someplace. What's going on with them? Do they have an infectious disease and pandemic plan? Ask them straight away. What's their current status? What's their situational awareness? Have they activated any of their plans? Could they answer any of these 10 questions that I'm asking you to answer? And the big question is can they deliver what you bought as they're supposed to? Or would this illness actually prevent them from being able to provide the services that you need? Really good to have this conversation with them right now. This has been going on with a lot of my clients who are getting phone calls from people asking them exactly these questions. Number 9, inventory your personal protective equipment. You know, what kind of stash do you have of masks and gloves and hand sanitizers and appropriate cleaning equipment and solutions? That's a good time to inventory all of this. And the reason that's important, I'm not advocating you wear a mask, but what I'm saying is that you might be in a situation where you have to have masks available for Category 1 staff. So why would you ever have a mask on at work? If you're in a situation where somebody is sick right in front of you, you can certainly mask them, but I'd be very inclined to mask myself, especially if I had to do anything to assist them. Secondarily, you might be in a situation where there's a disease outbreak in your facility, and you need to have there's a job where people have to get close together to do something. So imagine some maintenance people and they're doing some work on some plumbing, and they have to be quite close to each other to attach a very large pipe. At that point, I would probably put masks on both of them so they're not breathing in each other's space of 3 feet. So you want to make sure that you've got enough personal protective equipment that if people come to work in the middle of a disease outbreak, they're not going to feel afraid because they don't have a way of protecting themselves. Masks generally, regardless of what you see on the streets in many parts of the world now, masks generally are not a good idea. They're only really a good idea if you are sick and you're trying to prevent other people from being sick, or if you're in a situation, again, with close proximity. The only difference I would say with that is if you're on a plane, and I fly about 200,000 miles a year, so I carry masks with me all the time. If there's somebody coughing around me within 2 rows, your chances of actually getting sick are really good. And so it's really important that at that point, I put a mask on myself because you want to make sure that you actually don't get sick. And there's a lot of studies that show that those 2 rows actually are the ones that do get sick. Lastly, you want to really look at increasing your information security screening. There has been lots of additional hacking. Scammers and hackers are pretty smart, and they know how to really feed on our fear. So IBM and the Kaspersky's both issued reports in the last week of hackers sending spam emails, lots of phishing, in hopes of really getting people to make a click to release some obvious malicious malware, either some form of malware or a ransomware. And again, these are emails that look pretty legitimate. They say they're talking about the coronavirus, and if you want more information or if you want to buy masks or whatever it is, click on this, and then people, of course, do that. So this is a good time to educate your staff, remind them about phishing emails in particular, and clicking on anything. And I would use the coronavirus as a good example about getting people to click on things that they might otherwise not. So here's a summary of all the things that I think that you need to be doing right now. Hopefully you've got a lot of them checked off of your list already. If you haven't, it's time to get started. And I would really start, these are almost in the order that I would do them. So let me talk a little bit about personal and family preparedness. I can't do a talk like this and not talk about what you should be thinking about at home with your family and yourself. First of all, wash your hands, and I mean a lot. My background was originally in nursing. I was a hospital administrator many years ago. So I come to this profession, if you will, with that kind of a nuance. Washing your hands is very important, and it's one of the most important things that you can do, and you should wash them often. You want to make sure that you use lots of soap and water, and ideally you're using a paper towel so you can dispose of it, not a reusable towel. And you also want to make sure that maybe using a dryer is fine as well. The key thing that you want to do, and this is the hardest thing to do, stop touching your eyes and your face. The average person touches their face between 16 and 20 times an hour. So maybe right now you're listening to me and you're scratching your forehead or you're leaning on your hand. Okay, all of that counts. It's really hard to stop this. It's a very common human behavior. And the reason that that's such a problem is your hands are a vehicle of getting viruses and bugs close to your airways, of which you can inhale them, or it gets into the mucous membranes of your mouth or your eyes. So you want to make sure that your hands are washed, but secondarily, you want to avoid touching your face. Avoid sick people to the best of your ability. It's kind of hard if it's your family member, but try, make sure that you have as minimal contact with those folks as you can. Use hand sanitizers when you're in public and you don't have a hand washing available. So if you take public transport, for example, I do that. I have a big container of hand sanitizer in my briefcase. I carry it on a plane. I use it all the time. And I use it when I go to meetings. As I mentioned about masks, you want to wear them if you are around sick people, really close, because you're trying to help them. If you yourself are sick, and for example, you go to a doctor's office, you should be wearing a mask. They'll usually put one on you right away. And if you're in a plane with people that are coughing, you want to make sure that you actually have a mask as well. And really, I'm not trying to scare any of us in this whole issue related to the coronavirus. What I'm asking us to do is be smart. And these are common sense, basic disease things that, frankly, you should be thinking about during the flu season every single year. The thing I would really ask you to think about is to really review your crisis management plan for the process that we talked about here today. And if you have a disease plan, pull it out and really rethink of how you use it. And if you don't have one, start writing one or hire somebody to do it for you, but you need one. to give you guidance. And lastly, what I would really say to you is it's really important that you take this threat seriously, because it's going to go on for a while, which leads to my significant last point. You need to be prepared for this to go on for a while. I have clients of mine that have been activated 24/7 already for 3 weeks. Well, you know, most corporations don't have activations that go on for any length of time. We may activate once every year, most likely not, and we don't usually do something that goes on for days nor weeks. So I would really encourage you, you need to pace yourself. This is going to go on for a long time potentially. It could be weeks, it could be months. So you need to be aware of staff fatigue, and that includes your own. I would encourage you to develop staffing charts. So I've asked my crisis management teams that I work with, that we've designed, that they should be making sure that they have really clear call schedules. Who's on call, who's running calls, especially if you're doing calls in the middle of the night with different countries. You need to be sure that we have the ability to spread the work out so that we are not going to end up in a poor condition ourselves. Because I'm really encouraging you to really think about and be ready for the long haul, because this could go on for months. And then lastly, if you're not a crisis management professional, I could teach you hours and hours in workshops on crisis management process. If you don't have a crisis management plan, I don't normally pitch a book of mine. I've written 4 books, but this one I would highly pitch to you, because you need some processes in place. And so if you have any interest at all, you can check them out on Amazon. Lastly, before I hand it back to Sal, I'd like to just say, please link up with me on LinkedIn. I do lots of posts about the coronavirus every day and other crisis management related activities, and I'm happy to share anything I have. So please follow me, and I'm happy to respond to any questions. So Sal, do you have some questions for me?
Sure, I do. So let me take the presentation ball back. So we are going to do a Q&A now. So I did want to remind the audience that in order to submit questions, please go to the GoToWebinar control panel to submit those. We do have some in already. We also do have some additional resources that I would like to make the audience aware of. We have the links listed here, the bit.ly links as well. If you did want to download them now, or you will receive them in our follow-up. So we do provide at Everbridge a coronavirus situation report that we update frequently. It does really focus on really from a business continuity perspective, talks about factory closings, talks about like as Regina said, you know, cruise ships and airlines that are being affected, as well as kind of the standard information about where the outbreak currently is, and numbers and location around spreads. We also have a coronavirus preparedness kit. So it's 4 separate documents to enhance your preparedness, general best practices, as well as a mass notification system check. We also have another webinar coming up. It is on February 28th, the coronavirus response, government policy, and operational response. So please do look for that. Please do look for that link as well, and hopefully we'll see you on February 28th. Now, as for questions, I also wanted to just mention, because this question has been coming in, we did record today's session. We will provide today's session as well as the slide deck later this week. So we have questions coming in fast and furiously. I want to combine 2 questions, Regina, for you.
Sure.
So it's really around what does shutting down means? What does shutting down mean? So one question was, it was mentioned that a location will be closed if an employee was to contract the virus. Does that mean the building they worked in, or the whole facility? Does it cover buildings and acres? And then another question, very similar. I figure I'll read it. We are a highly residential campus. You mentioned if there was a diagnosed case, it would likely be shut down for 14 days and will reset with each new case. Will they give special guidance on what shutdown means within those residential communities?
Yes, so thank you for that. So yes, indeed, absolutely. The public health department will be very explicit. So a couple things. The first thing they do is if you have an identified case, so let's say that you have a person A in your organization, that individual, they're going to know, first want to know what their job is, where they work, where they sit, who would have had contact with them. Do they park in a garage? Do they go to the gym in your facility? Do they go to your cafeteria? Do they go to a break room? And you can begin to see really quickly, they're mapping out who this person might have been in contact with. Do they use a restroom? Well, you know, it doesn't take long to figure that out. So very likely what happens is that what's going to happen is they're going to then take a look at that, and very quickly what they're going to decide more than likely is what they just did in Singapore is they started shutting down the high rises, or the entire high rises where people were actually infected, even though it was an employee of one floor, but they were in the elevators, they were in the lobby, they were in different places. And so to be extremely cautious, many health departments will shut all of them down. So in that case, in Singapore, they shut down an entire high rise, even though the persons were only on a couple of floors. But what you have to be prepared for is something as draconian as that. Now, it's the health department that makes that decision. You don't have a lot of control over that. You can fight with them. I wouldn't encourage you doing that because that just aggravates them, but they have the ability to do that. If you're in a residential environment, like a dorm, let's say, of a college, very likely what would happen is they would do exactly what they're doing on the cruise ship. They would quarantine everybody in their rooms. And just like in the cruise ship, you'd have to be figuring out either how to do room service or how to do meal service, where you could actually have people come to a dining room with 3 feet of space in between them, and then clean extensively between each serving or each meal preparation. So yeah, that's what that means, is basically quarantine in place. If you're residential, you'd be staying in rooms just like they are on that cruise ship. Or if you're in an office building, you should plan on all of the office building being closed.
Perfect. So I have a little bit more about travel restrictions. So I'll combine these two. Just in general, should people avoid traveling abroad to South America? And then another one is, given the robust measures taken by Japan and other countries, why do you advise no travel to some of these other Asian countries?
Well, in particular, if you look at where the case count is right now, so if you look at Thailand, Singapore, Hong Kong, all of those areas, of course, have a large case count. Japan has got a fair number of people as well. I would just be, if I was traveling to them, I would ask the question is, how mission critical is the travel? And so is it super important that you go? Is it something you could be doing remotely? If indeed it's mission critical, time sensitive, you got to go, then I think you just have to be smart. So what does that mean? I would have limited ability to, I would minimize my contacts other than what I absolutely had to do. So instead of going out shopping and doing things like that, I'd be like, I go to work, I come back to the hotel. I go to work, I come back to the hotel. So I would really be smart if I had to travel. As far as South America, there are no known cases in South America. There's no known cases in Africa yet. Most people believe that they are there, but they have not been tested.
This is a question that's come up a couple times. I'll kind of summarize it. What should organizations, both private organizations and then maybe like public organizations, states and cities and counties, what should they be communicating, kind of mass communicating now, if anything?
That's a really great question. I think I would go back and look at the same model you might do during the flu season. So I think you could certainly say that, something along these lines. We are monitoring the coronavirus. We have activated our crisis management infectious disease processes, if you have. We encourage all of our employees to be smart, wash your hands, good cough hygiene. Don't panic. Don't be, kind of overly zealous, but just be smart. And so I think that kind of reassuring message, and if you want to look at a good reassuring message related to that, the Prime Minister of Singapore gave a fabulous video about 9 minutes yesterday talking about the current outbreaks that are in Singapore. And he had this very reassuring kind of message, which is, we're on this, which is what your employees want to hear. We're monitoring this. We're taking care of it. We have your best interest in mind. We don't want you to panic. We want you to be smart. Wash your hands, use hand sanitizer, live your life, but, be smart. And that's actually a great video. I'd encourage you to look at that from a crisis communications perspective.
Several mask questions have come in, so let me try to summarize these. Is there a specific type of mask that you recommend? How many masks do you believe, is there a kind of rule of thumb for how many masks you should have on hand relative to, number of employees or hospital or anything like that? Mm-hmm. And when should they be distributed if possible, if needed?
That's a really great question. So the general rule is that the best mask protection is an N95, which provides you with a complete seal around your face. Those, however, are actually respirators as designated by OSHA, and you must be fit tested by them. So if you're going to disperse N95s, You need to actually have an OSHA-related program for respirator and training that goes with it. So just keep that in the back of your mind. But those are the most effective. Having said that, there's also people that cannot wear an N95, people with lung disease, asthma, and other things, because it makes it too difficult for them to breathe. So having said all of that, probably the most common masks you're going to find in most places are going to be surgical masks, of which there are some gaping around the side. Now, when would you actually use them? As I said earlier, I would only be using the mask in a work environment if indeed I could not social distance, that's 3 feet. If I was actually physically myself ill, if I was taking care of somebody who was ill. So let's say I'm an emergency response team member and I'm asked to go see somebody who's sick. I would put a mask on them, and frankly, I'd probably put a mask on myself. How long are masks good for? Once they become moist, then their efficiency in being able to filter particulate matter, such as microbes, diminishes over time. So you might see people wearing masks all day long. Well, they're not very effective after a few hours. So you would need to have a considerable number of masks if you were going to have a mask on somebody all day long. But I would say to you, why would you be having a mask on somebody all day long? More than likely, it's going to be because hopefully you can social distance people. Can you imagine being in a call center with a mask on for 8 hours? Oh my gosh. So, so you want to make sure that you really think through this logically before you think, oh my gosh, I have to get a mask for everybody. I need, 5 every day or something like that. So really think about why you would need them. That's what I would ask all of you to really chew on.
So, can you talk about, sorry, can you provide that 9-minute video, employee preparedness video you mentioned? Where can it be found again?
Actually, the video is actually the Prime Minister of Singapore. If you just Google the Prime Minister of Singapore's video, you'll find it. It's on YouTube. And it basically is him speaking to the nation of Singapore about the current outbreaks that are happening there and really what he wants them to do. And he is calm and reassuring. And, you just imagine that could be your CEO. It's actually really a great video to use as a model.
Can you talk about how impactful a situation report can be to an organization? How can, how can crisis management teams make optimize use of it? How can executives use it?
Yep, that's a great question. So I think first of all, you need to figure out what's important for you to know, right? So a SIT-STAT report is only as good as you thinking seriously about what kind of information you want to have. So that's the first thing. The second thing, it has to be really visually available. And that's why I showed you the WHO SIT-STAT report, color-wise, the organization of it. It reads quickly. It's a super slick way of presenting information. So I would encourage you to think about what do you need to know? And that goes back to my slides. I talked about there's 2 sources of information. There's internal and external. So I think you need to find out from your executives, as an example, what are they concerned about? Are they concerned about, how many units are getting out the door? Are they concerned about, how many people might be sick? Or they can, what you should be reporting on what people want to know. And then so in many of my clients who are especially in Asia, they're actually sending out these surveys on a daily basis. And they're actually tabulating that information, putting it together in a very digestible form so that people can really quickly look and see. So first of all, what do you need to know? What do your executives want to know? How can you then get that information internally? Because that's what the hardest stuff is to get. Make it simple. Maybe it can be done in some sort of a spreadsheet where you can then aggregate the data and pull it into a Word document. Think about that. And then also think about triangulating that with good external sources like the WHO, CDC, and some good news agencies.
All right, so I think we have time for one more question, and this is this is it. Okay, one of our sales reps from Wuhan, is from Wuhan, and was here on business last week. He has since fallen ill. What safety measures should we take right away? He has been in close proximity with approximately 10 employees for 4 days.
Oh my God. I would first of all say, why did you do that? But I won't do that. So the first thing is, if you have somebody that came into your office, you should basically quarantine everybody that was in with those people. They should all be home. Those 10 people should be working at home for 14 days right now. The guy from Wuhan, if he can get back to China, bless him. But those 14 people should be quarantined for 14 days, and I would want to deep clean any rooms that they were in, conference rooms at your office. I would deep clean all of those spaces. And let me just paint you a really quick example. I know we're almost out of time. There was a guy that actually, a British citizen who was in Singapore for a short period of time, left Singapore, went to the French Alps. He actually was in a chateau with other people skiing. That one guy infected the 4 people in the chateau, 5 other people, 1 person in Morocco, which is an island nearby in the Mediterranean. And they actually think now he might be actually deploying this virus through all the people he had contact with to the UK. So sometimes you can be in the presence of somebody who is what's called a super spreader, or somebody that actually is just going to be more highly infectious, and you don't know who those people are. So if you had somebody in your office that was from Wuhan, those 10 people that person was with, go home for 14 days. Thank you.
Sounds good. Okay, that's all the time we have. Regina, thank you for your information that you provided today. It was very useful and obviously very timely. And I'd like to thank our audience, especially the fact that there's so much of the audience stayed for the entire hour, which is great. So again, to everyone who's still on, please look for a recording of today's session. Look for the slides, and then look for links to some additional resources that we hopefully you will take advantage of. So thank you, everyone. And Regina, thank you.
Thanks, Sal.
All right, bye.
Bye-bye.